You think like you come from one of the best hospitals in the country, if not the best, and then you'd be the arrogant new guy in town who's better than everybody. And it's like, whoa, you've got to be humble. I see people thriving in social media who are dancing on operating room tables. These are grown-ass men and women who are parading around with their 20-something staff and doing these like TikTok viral. And it's a shame to see that these people who were my mentors at one point kind of dancing around making, a parody of themselves. But that's what it takes in this community to shine. Social media is an opportunity for plastic surgeons to lie. It's an opportunity for the aesthetics industry to lie. I think befores and afters are embellished. Who is the one making decisions in terms of adopting new technologies? The providers are too. So we're also falling victim to these huge industry companies. I want to adopt this new $250,000 device for my company to help people. And then we do it for 2 years and we realize the results are nothing. I'm not going to lie. I'm not going to be my Newport psycho and tell you with straight face, oh yeah, it's going to last forever. I'm going to tell you, I don't know. We don't know. The second we as aesthetics providers suggest seeing a therapist, we are insulting them. Even if our intentions are to help them, we are hurting their feelings and we are undermining all these concerns.
I'm Ashley.
And I'm Maddie.
And this is
The Newport Psycho. Oh, it's going down today. So we are welcomed by Dr. Jonathan Zelken.
Dr. Z.
Dr.
We are
Z.
welcomed again.
Yeah. Well, yeah. So long story short, guys, we've recorded this and then our audio didn't work. So he's back.
He's back.
Let's
So
do a short
round
story
two.
long here, okay? I was very upset when I found out that my audio was something happened.
Because it was beautiful.
But then like the opportunity to visit you guys again is such a wonderful opportunity. It's so uplifting.
Yeah, we're
And-
pretty amazing.
And
We really are.
you can't underestimate our environs.
Yes.
Look where we are.
We're on a yacht, if those who
But
don't
it's-
know.
But anybody could be on a yacht. Like we're on a yacht in the middle of Newport Harbor.
Yeah, that's pretty cool.
And there's a lot of Newport psychos around us.
Yeah, honestly, we
you
should,
could probably pick one up.
we
off the street.
really should go around after this and
An
say, who's your
interview.
Newport Psycho? Yes.
Just interview Newport psychos.
We should. Absolutely.
Probably not a bad idea.
So, Dr. Z,
Yeah.
tell us a little bit about yourself.
I'm a plastic surgeon in Newport Beach, California. I'm from the East Coast originally.
Mm-hmm.
And I came here 10 years ago. I wanted to go back to the East Coast, and my wife was like, it's either me or New York. And I said, okay, fine. So I've been here, and I've finally set my roots here, and I'm like you. I'm sort of like, you're from Colorado, but I now associate you with Newport.
Yes, exactly.
And now I feel like I'm part of the mesh, the lattice work here. It's a small community.
You're embedded
Kind of
now.
know
We're
everybody.
transplants.
Yeah, we're all
We are-
transplants.
Yeah, we're all
She's an
transplants.
Arizona
too?
girl.
Yeah,
Get
Arizona
out of
girl.
here.
Mhm.
See, I would never have guessed ever a million years.
You thought Newport.
Mm-hmm. So it's a wonderful place to be living, but it's also a wonderful place to be a plastic surgeon. I think,
You're in the
some,
Mecca.
it's the Mecca. I mean,
Yeah.
we're a little bit overshadowed by Beverly Hills, maybe, but then everybody from Beverly Hills comes down to us because they're sick of the Beverly Hills nonsense.
Yeah,
Mm.
we're better.
So we're in the same metropolitan area. I do plastic surgery of the breast, body, face, but I do focus my efforts on the face. I like facelifts. I like custom facial implants. And if you guys want to ask me about that, I'm sure I'll preach and I'll drone on and on about it. Anything from Botox skincare to breast, body, fat transfer, you name it, I offer it, and I'm
You
happy to
do
weigh
it.
in.
You're the
Yeah.
man.
So I just want to reiterate what he said last time on his podcast.
Wait, what?
He started off with, "I am the best surgeon."
That was my shtick.
Yeah, that was your stick.
I'm the
Can you
greatest
do-
surgeon in Newport Beach. Yeah, I'm the greatest Newport Beach plastic surgeon.
I
Yeah.
love
And I'm
that.
saying it with a straight face
Yeah, I love
because that's my Newport psycho.
it. Okay.
Wait, yeah.
Is the sociopathy of plastic surgeons.
Please explain.
Because if you really think, especially those of us with only a few gray hairs, think you're the best at what you do, and some people really do, genuinely think they're the best at what they do.
Mm-hmm.
I think there's something wrong with you. I think you're not putting yourself in a position to grow, to expand, to learn from your mistakes, and to really try to appreciate the art that is plastic surgery. But at the same time, to market yourself in this cutthroat community, you've got to really believe you're the best and sell it. You got to sell it. So I started last time saying, I'm Dr. Jonathan Zelken, Newport Beach's best plastic surgeon. And I said it with a straight face. And then I smirked because I can't say it with a straight face. Because to say it with a straight face means that you are not opening yourself up to improvement, to becoming better, to being the best ongoing, and understanding your own weaknesses and the weaknesses in what you offer. So that's my Newport Psycho.
I was literally going to ask Jonathan, who's your Newport Psycho?
Myself, my alter ego.
Oh my gosh.
Okay.
You know what I mean?
Okay.
And I don't want to be that guy, and I try not to be that guy. And like, we're going to talk about social media marketing and things like that, because I think that's really all that fits in my psycho, is like the classic plastic surgeon who is not afraid to embellish results, not afraid to lie, not afraid to say I'm the best, and not acknowledge his or her own weaknesses.
True.
And that's so omnipresent, not only in this specialty, but in the aesthetics industry as a whole. So if you want me to branch out a little bit, I'll say that my Newport Psycho is aesthetics marketing as a whole.
Nice.
That's not just plastic surgeons. That's industry too.
So for your career, how long have you actually been in the industry?
Ooh. It's kind of a hard question for a plastic surgeon, because we train for so long, and half plastic surgeons incorporate that into how long they've been doing it. I've been on my own for 10 years.
Okay. But before that, like, I thought it was super cool. I had no idea where you trained.
Johns Hopkins.
Like, when I hear of fellow like faculty that train there, I think that's incredible.
Johns Hopkins was a really, really special place. Baltimore, Maryland is a great place to be from, but not necessarily a great place to be. It wasn't the best 7 years of my life, but at the same time, like, I sit back and I reflect on my experiences there, and I think it helps me really understand the nuances of every decision we make. I mean, we are surrounded by great people, great mentors, the best in everything, and that's very inspirational. So when you come to a different place and you transplant elsewhere, it gives you a certain humility that like, it's hard to sit there and look at a camera and be 41 years old and say, I'm the best plastic surgeon in town.
Yeah.
But everyone else can do it. And it blows my mind that people can do that and be honest with themselves. So I think part of being a Hopkins alumni is a certain degree of humility. And it seems backwards. You think like you come from one of the best hospitals in the country, if not the best, and then you'd be the arrogant new guy in town who's better than everybody else. It's opposite. You know, you understand that there's so much to learn, that every operation that we perform, every milliliter of filler that we inject is an opportunity to learn and grow, and to be better, not to be the best, to be better every time.
I feel like that's like really awesome though, because a lot of people don't want to, they think that they're so great and they're at the top, right? But where do they go from there? You have to continuously grow.
There's
I
always
think it's actually toxic to say that you've hit the top and you're at the top.
Yeah. There's always room for improvement. Yeah. I mean, even like, I'm a national trainer for Allergan. They send me all over the country to train other injectors. And every time I'm in a training, I say, this is more of a collaboration, because I don't care if I've been injecting longer than you, I'm still going to learn from you and you're going to learn from me. And I think that that's super important, just because they might know something that I don't know. And not only that, but why wouldn't I open up to seeing what others do? Because what if it's way better? I don't care if they've been injecting for a year. Maybe one of their last trainers was like one of the best trainers in the country, you know? So I think it's super important to continue to learn. And I love that.
What a wonderful thing. And like and even when I go back to my training, I think about like the mission work we used to do in Vietnam. Like, we would go and we would do thumb transplants on people who lost a thumb, from their toe to their thumb. We would do cleft palate, cleft lip work and things like that. And we would be surrounded by surgeons, plastic surgeons in rural parts of like Hanoi and stuff like that. And what we would consider kind of developing parts of the world. And these surgeons were fantastic, and they were better than we were. And all this time we think we're the best. We're Americans. We're going to come in here and we're going to show you how it's done. The reality is we learn from them. And every time you want to learn something, you want to come up with, innovate, and you Google something, you'll find out that your novel idea was published in a journal from Syria 20 years ago. And it's like, whoa, you've got to be humble. You've got to recognize that there's more out there than the LA metropolitan area. And none of us, I don't care who you're thinking of, none of us are the best.
I love that.
I love that. So like, the word is just humility.
Yeah.
Like, you have to have that. especially in plastics, especially in aesthetics.
Yeah, speaking of thinking you're the best and everything, how has social media like impacted you and your business?
Social media is a real conundrum for me. It's the hardest thing in the world for me to try and master. I'm not even going to begin to try. I can't even begin to try. I see people thriving in social media who are dancing on operating room tables, who are parading around. You know, these are grown ass men and women who are parading around with their 20 something staff and doing these like TikTok viral, basically preempted kind of like scenes with some reality show thing in the background, making the audio while they're doing the video. And it's a shame to see that these people who were my mentors at one point kind of dancing around making a parody of themselves. But that's what it takes in this community to shine. And to try and rise above that and say, I'm not going to allow myself to do this, has pretty profound impacts in terms of like my own personal or professional growth. But at the same time, I want to continue to just try to continue to persevere and create great outcomes and grow that way. Social media is an opportunity for plastic surgeons to lie. It's an opportunity for the aesthetics industry to lie. And, I think befores and afters are embellished. I think people call themselves triple, quadruple, quintuple board certified, but it's not necessarily in plastic surgery. Befores and afters, the lighting, you know this as well as I do, Maddie. I mean, the lighting can totally affect the result. The
angle of the picture,
which it gives clients unrealistic expectations. Yes, and that's where my thing is I don't mind the TikTok and everything, but obviously I'm a younger generation than you two. So by at least a decade. Thank you very much.
You made fun of my dad hat before.
Hey, it's a good hat.
It's a great hat.
But
it's a handsome hat.
I think, to me, I don't care what you do on social media. I really don't. As long as the proof is in the pudding and you're actually giving your clients realistic expectations. So with me, it's like, if you want to dance, like, I think it's adorable. Like some of them, I think it's funny. And I think that if that's what you want to do to bring in clientele, I'm all about it. But as long as you are actually giving the clientele what they expect, like, please do not show something on social media that's not real. And then that's where I don't like it. Like, if you can do whatever you do to market, whether it's before and afters that are like actual realistic, like you, or focusing on that, or dancing on a table, I don't care. But at the end of the day, patients should always come first, and they should know their expectation and know what they're getting into. You should not lie to a patient. You should not edit photos for like before and afters for a patient. Like, they should know what they're getting into. And that's like my main thing.
That's a beautiful counterpoint.
Thank you.
And you totally put me in my place there. You're right. If someone's dancing or being a goofball, maybe that's an opportunity to really show their inside, who they are. And that's what the consumer wants to see.
Yeah.
And maybe I have this a slight amount of elitism, or like, we should be holier than thou type of mindset, where I think it's inappropriate personally, but maybe that's actually what people want. And if someone's being genuine and that's who they are, you're right. More power to them.
I feel like it's authenticity. But I feel like when it comes to social media and marketing, I feel like the ones that actually really succeed is the authentic. Like, it's always like real and raw.
Yep.
It's not the filtered, because as a consumer, I'm not obviously an NP and I'm not a plastic surgeon, but I feel like as a consumer, I do look at social media. I do go on there and I'm like, okay, if I want this done, or if I want to breast aug, right, I'm going to go look at his entire portfolio. I'm going to go look at his website. I'm going to do this whole thing. I actually don't look at the ones that are making those funny videos on top of the table with a bunch of people dancing. Those are cute, but it has to be copy and paste. Their work has to look consistent.
Yeah. And not only that, but like, there's got to be different consumers for different providers,
right? You got to find your match.
So in your defense, there's going to be people that agree with you. Like, I don't want a surgeon that's doing that on social media.
I don't want to be operated on a table where someone's feet were. Well,
that's what I'm saying. Like, they might look at them and be like, I don't want that surgeon that's like doing that.
Because I have like OCD.
That's what I'm saying. Like, you're very like, you're very like, but you both are very like, I can tell, like, type A, I'm very more type B. So it's like,
no, you are okay. You are very type A.
She's very type A.
You think so?
I am type B. I am literally type B. You are so type A.
Sorry. With professional, like with my work, type A. Yeah. Everything else, totally type B.
Yeah. I feel like
come on.
Oh my gosh. Well, anyways, get to the point is there's going to be a different provider for a different patient, and it's going to coincide.
Correct.
So there's a lot of patients out there that might see that and be like, oh, heck no, I don't want my provider doing that. And then they would go to you, you know, they're more.
So the common theme here, the common bond between what we're saying, or duking out or fleshing out here is authenticity. Authenticity is really what it doesn't only target consumers. It's not like, oh, you know, woe is me, the consumer, I don't know what to believe anymore. It's also plastic surgeons, because it's the entire aesthetics industry. It's nurse practitioners, it's nurses, it's everybody, because who is the one making decisions in terms of adopting new technologies? The providers are too.
Yeah.
So we're also falling victim to these huge these huge companies that are telling us we've got the new latest and greatest laser. We've got the latest and greatest energy radio frequency technology that's going to eliminate the need for facelifts. And so then you've got plastic surgeons, nurse practitioners, PAs, nurses who are saying, I genuinely want to help my patients. I want to bridge a gap. I want to adopt this new $250,000 device for my company to help people. And then we do it for 2 years and we realize the results are nothing.
Yeah. Or it goes too deep and melts people's fat.
Or it goes too deep. And we can get in all of this. And meanwhile, these industry providers, knowing the flaws of their company, are motivated to continue to push. And so it is a really, really tough time to be a patient. And it's also a tough time to be a provider.
No, I agree.
And so that's why, since our last iteration, I don't want to interrupt you.
No, you're fine. You're fine.
Since our last iteration of this show, this is version 2, I have changed my viewpoint from this fakeness in social media marketing to just the beauty industry as a whole.
Correct. So I do have a question though, because to just reiterate from what you said previously, you said the triple, quadruple, board certifications. What does that mean? Because I know as a consumer, people want to know what that actually means. And I'd like to know what that means on a professional level.
You know, you asked me about my wife. You walked into my office a few weeks ago and you saw Kathy Zelken, MD, on the door. And you're like, you have a new plastic surgeon. Who's Kathy Zelken? There's 2 Dr. Zelkens. Wow, this is fantastic, right? You know, Kathy Zelken is a board certified pediatrician. But when she comes in and she assists me in surgery, she's board certified too. I'm board certified. She's a board certified provider. And when she performs plastic surgery, which she will never do, she's a board certified plastic surgeon. She could say that because I'm board certified in pediatrics, but I'm doing plastic surgery. So she's board certified. So you can sort of twist words, for example, and you can be a board certified provider. I could be a general surgeon who is board certified. I could have maybe done an internship or some training in internal medicine and ER. I'm double board certified now. I'm dual board certified now, and I'm providing plastic surgery, options for the community. So I'm a board certified surgeon. But it's incumbent upon the consumer. And this seems like second nature to me. It seems intuitive, but it's not to everybody else. That board certification doesn't just mean you're good to go. You've got to be board certified in plastic surgery, specifically by the American Board of Plastic Surgery, which is the only, medical subspecialty board certification that counts.
Okay.
So ER doctors, OBGYNs are all cosmetic surgeons, and that's fine. They are allowed to, and oftentimes they do a great job, but it should not be confused with a board certified plastic surgeon. You got to ask, board certified in what? You see what I'm saying?
They can have different credentials. That's I never knew that, because I've seen triple, quadruple,
what's
board
crazy
certified
too is even working for a plastic surgeon, I just figured that when they say they're board certified, because my surgeon was board certified in plastic surgery. All my surgeons were that I worked for. I just figured when I went to a plastic surgeon and they said board certified, in my head, I'm like, oh, they're a board certified plastic surgeon. I had no idea.
Anybody who does any plastic surgery is a plastic surgeon, right?
Yes.
Think about it. If you're a general surgeon and you do liposuction, you can go out and I'm a plastic surgeon because I do plastic surgery. That's true. I'm a board certified plastic surgeon. I can say that's true. They are allowed to do that. They're qualified to do that. If they're trained, if they're good at it, more power to them. But don't confuse that for a second with board certified plastic surgeon. You could be a plastic surgeon. You could be board certified, but that construct of board certified plastic surgeon is a unique experience. And there's not many of us in the world.
No, there's not. And I guess
that's mind blowing to me, because I never knew that. I thought it was just across the board.
I always tell my clients that I send people to. Obviously, I only send them to board certified plastic surgeons. I send a lot of my clients to you.
Thank you, by the way. I appreciate
it. Love you. But I always say make sure that they're board certified. But now I need to say, well, good thing is I send them to board certified, but I need to say.
Or in head and neck surgery is fine too. Otolaryngology is fine too.
Yeah, like,
they
well,
could do a
something.
year
Yeah.
in facial plastic surgery.
Yeah.
Okay.
But it's still, so you got to be a little sophisticated as a client now.
Mm-hmm.
And I think with social media, it's really easy to sort of fog up the qualifications and to say I'm board certified. You could just write that under your name on Instagram. Board certified doctor, board certified physician. But it does take a little bit of extra homework, I think, on behalf of a patient nowadays to really understand what that is, and to factor that into your decision making. Is this going to change my decision to go with Dr. X versus Dr. Y? That's going to be a patient to patient decision.
It's going to be like a personal thing.
But we must empower the patients to understand the difference, and then they can make a decision for themselves.
I would want somebody that's board certified in plastics.
Yeah.
Like there are horrible board certified plastic surgeons,
true,
and there are
and
fantastic board certified cosmetic surgeons who do a weekend course in Vegas. Okay, but we just have to allow the consumer to understand the difference, and they can do their own internal calculus and stuff like that and decide what they want to do. But I think with information and knowledge comes more power, better decision making, better understanding of why price points might be different, better understanding of accountability.
Yeah.
So on the road of plastics, what's your favorite procedure?
I love facelifts, and I love facial implants. I love custom facial implants. I love reshaping the facial skeleton and the soft tissues of the face. I think it's
actual
beautiful.
implants in the face.
Actual implants in the face, and we've been doing it like forever.
That's like so crazy. I don't think I know people with chin implants.
Yeah.
Yes, but there's something new about it. There's a new tide coming,
Okay.
and I can talk about it. Go on.
Yeah, no, I was gonna say old school, like even like 10 years, like when I was in plastics.
Yeah.
There was like literally only like a certain amount of implants. So it's like you either get this size, this size, this size.
Small, medium, and large.
Yep. So I remember when we do chin implants, it was like, oh, we literally just put it on. Oh, that looks good, And now you can like customize them specifically for a patient. Correct?
Yeah, you're right. It's like going to McDonald's. Like, I want a small fries, please. And I would look at, if it was a woman, it would be a small or medium. If it was a man, it would be a large or maybe an extra large. And like, that was all of the mathematics. That was all of the artistry in terms of ordering and placing implants. And you create a pocket, and if it's too big, then maybe you can take a knife and whittle it down a little bit and put it back in. But that was it. That was the precision, and that still is. That's still like the lion's share of facial implants. Like probably 97% of all, probably 99% of all facial implants that are placed are off the shelf. Call a company either in Ventura, California, or in Miami or something like that, and you order, I'll have anatomic chin in a size medium, please. It comes and you place it, and it's sort of set it and forget it.
It's literally like McDonald's. Like,
no,
can I get a chin in a medium, please?
We'd have like samples of them in there.
And people love it. People
crazy.
love that.
It's like crazy.
And it works really well. And I can think of hundreds of implants that I've placed and not really had issues with it. But I'd say over the past 5 or 10 years, the idea of custom facial implants is starting to take root. And there's not many people who do it. I can think of probably 4 or 5 surgeons in the country who are routinely offering these. I can rattle off maybe 4 or 5 names. Maybe there's more. I just don't know. I am one of them. I can say that with a straight face. And I love the idea of getting a CT scan. And it doesn't have to be going to the hospital and getting a high radiation one. You can go to a dentist's office, get a high quality cone beam CT scan, which is like the dentist type of CT scan. And then you get basically a 3D model of your facial skeleton. It's kind of cool. So like I'm looking at a computer image and rotating your skull around. And we can shape it how we want to. If you've got weak chin, if you've got weak jaw angles, we can literally like shape the perfect facial skeleton. And from that, we can get these 3D images of the changes we've made and print them out in plastic.
Wow.
And then make a small pocket and put it in. So you're literally playing God in a sense. Like you're literally reshaping the facial skeleton. You're not like just taking something off the shelf and seeing how it fits. You're saying, how can I make my great face better? Shaping it, printing it, and putting it in and putting a screw in to fixate it. It's
insane.
A very, very cool operation.
And is it like obviously a lifetime? Like, does it last forever?
That's a really great question. I mean, the implants that I've placed in the past have been mostly silicone off the shelf devices. In the past 2 years, I've really picked up my custom practice. And these are designed to last forever. They're fixated with a screw. There's some discussion of whether or not it's going to cause bony resorption. That we've had this discussion with silicone too, whether it's going to reshape the bone underneath. And I can't tell you. I'm not going to lie. I'm not going to be my Newport psycho and tell you with straight face, oh yeah, it's going to last forever. I'm going to tell you I don't know. We don't know.
Because the studies aren't there yet.
Studies aren't there yet, but the implant material of choice as of today, which is what? We're February 2025, is polyether ether ketone, which is called PEEK, P-E-E-K. And that implant is something that we have placed in the skull since the 80s. And there's been no issues with body's rejection of it or like titanium. Sometimes you can have allergies and things like that. But the plastics, the thermoplastics that we use, like polyether ether ketone and polyether ketone, there's different ones that we can use, have really good track records of biocompatibility. That's 20 to 30 years old. Silicone does too. Silicone has great biocompatibility too. We've all heard stories about breast implants and breast implant illnesses, but as far as facial implants, silicone does great. So I'm going to say with a straight face that the plastics in facial enhancement have been doing wonders for 20 to 30 years. And so that's what I'm using. That's what I'm choosing. And I'm pondering creating a medical device company.
Ooh.
Because I love the direction. I love it.
I love that for him.
I love that.
I love that for you.
Yeah.
Really?
Yeah.
I feel like you're the perfect person to do that too, because you're very precise.
Very precise.
Very precise. I love it.
Okay, so I'm going to jump the gun and I'm going to go back to social media. Have you noticed like trends in like procedures from social media? Like, for instance, like everybody wanted a BBL when Kim K had it. Like, well, I don't.
Kim K, yeah,
can't confirm, but she had. It looked like she might have gotten a BBL, and so a lot of people were getting that. I mean,
the BBL was super popular, and I love the idea. I love the idea of taking fat from one place where you don't like it and putting it. It was super popular for years, and it still is. But it gets a little bit of a bad rap. So like you're starting to hear more terms like the Topeka tush or whatever.
What's
like
a Topeka tush?
I just heard about it.
Wait, what is that? Like I need
it's like a subtler BBL.
Oh, Topeka.
I called it the NBBL, the Newport Beach butt lift.
Oh,
because
just like
the little Topeka.
I mean, everybody needs that. I just did a thing on Ozempic butt because like everybody a lot of people are saying they need volume.
It's like facelifts. You want a subtler.
They want a little more rump.
A little bit more rump, but you don't want to look
the Topeka tush.
So you don't want to look bottom heavy either.
Yeah.
Right?
You
want that athletic. A little caboose.
Yeah.
So I think that the dial is being turned down a little bit on the BBL. Okay. In terms of like people's demands and things like that. Blepharoplasty, you mentioned earlier, is really popular. Super popular.
Like Caitlin Bristow from The Bachelor.
Yep,
she
was open about
like her open I have a bunch of friends that are getting it done. I mean,
buccal fat removal.
Yep. Which I had done.
Took a huge dip. Even during our previous filming of this podcast. Last time you filmed me, I would have been like, yeah, it's really slowed down. I don't know why social media is killing that star, but it really took an upturn in the past like month or so. I'm doing 2 or 3 cases a week again.
Wait, of buccal fat removal?
Yeah.
Again, when you go to the right provider.
Yes. Because that could be really bad, right? Buccal fat?
I think
so.
No?
I don't think so.
Straight
face, Newport Psycho, straight face. I don't think buccal fat
for the people that don't know removal. What buccal fat is, like what is it on the face that you would be removing?
Do I have a little time to talk about it?
Yeah, I'm happy to. But I'm going to tell you, in my opinion, there can be a bad buccal fat removal if it's not the right patient. If they already look gaunt and they don't have much there already and you take that fat away, I think it does look bad. Okay. I think it's going to somebody like a provider like you that's going to say, hey, this is going to benefit you and this won't age you, right? So I do think it's the right patient for that procedure.
Okay, so use my face. I've never had it. Would you say?
You don't need it.
No? That's what I'm saying. So like I would be.
What do you think?
I mean, one thing I've said, and my YouTube channel has a lot of videos on buccal fat because we do this awake. And so when we do awake surgery, I have no qualms about filming the cases. So we have a lot of content about buccal fat pad removal, and I have a lot of opinions on it. I've had buccal fat pad removal. You've had it.
I have.
I think the right patient is somebody with fullness in their cheeks who wants it out. Because we all have buccal fat pads. If your surgeon's telling you, I'm sorry, I looked, you don't have them, it's a lie. Everybody's born with buccal fat pads, and everybody's buccal fat pads, large or small, Asian or white, Hispanic, you name it, are about the same size, regardless of BMI, regardless of gender, regardless of race. If you want a little bit more contour in your midface, buccal fat pad removal is a great way to go. Yes, it takes a prudent surgeon to say, I don't think it's going to look good. See? It does.
And I know you've said that to people before.
Of course.
That's what I'm saying. It's like,
of course.
Everybody, like, it gets this bad stigma.
Mm-hmm.
And it's when maybe patients that probably shouldn't have got it in the first place got it.
Correct.
For me, if you guys saw, like, we can even put up a high school picture of baby Maddie. Your girl had a round ass face, okay? I was just a little circle face. And I always wanted more
braces,
contour.
acne everywhere, mullet.
Yeah, maybe, no
Did
mullet.
You have a mullet?
No, I didn't have a mullet.
I
was kind of cute.
I to see that.
I definitely didn't peak in high school, which is nice, but I was okay. I was cute, okay? But I'm cuter now. Let's just say that. And that was like one thing. And my surgeon, I remember I went in and I was like, I want a chin implant. I want a chin implant. And he was like, I don't think, because I was like, I want my face like more like elongated and snatched. And he's like, I don't think you need a chin implant. If anything, I would do buccal fat pad removal. And I was like, what's that? And this was when I was 25. So this is a little over 5 years ago. So yeah. And nobody really that I knew had it. And then all of a sudden, like 2 years ago, people were like, if you had buccal fat pad removal, you're gonna regret it.
You're gonna be gaunt. You're gonna be begging that you didn't have it done when you turned 50. I know. I've heard it all.
I called my surgeon, who's like a dad to me, and I was like literally about to cry, and I was like, "Did I make a mistake?" Like, blah, blah. He goes, "Maddie,
I remember this."
Yeah, I literally had a panic attack. We've been friends for like 3 years, and I was like, "Oh my god, oh my god!" And he goes, "Maddie, do you like the way you look right now?" And I was like, "Yeah."
I told it myself.
I was like, "Yes, I do," and he was like, by the time that, God forbid, this would ever even be an issue, you're going to be like 80 years old and you're not even going to notice it. Like, it's not even going to be a thing. Like, by that time, other things have aged, everything like that. He's like, but you'll never, he's like, it's not going to impact you. Like, and I like.
And it hasn't impacted you.
No, it hasn't.
And I will tell you, I've probably done 500 patients, probably 1,000 buccal fat pads removed. And I'll tell you, if I were to go back and say, in terms of patient criticisms, I can think of maybe one or two who are like, oh man, I wish I hadn't done it. You know, for just, it didn't address the area that bothered them. One or two. I can think of way more patients who feel like it didn't do enough as opposed to doing too much.
Yeah.
I had my buccal fat pads removed a year ago, well, May last year. And I have a pretty thin face. I'm not a thin boy, but I have a pretty thin face and I'm in my mid 40s. And it was one of the best things I've ever done for myself. I love the result that it gave me because I had mobile fat pads. When I'd talk, it would like kind of punch out from side to side. And I'd see myself from the back on videos and stuff. And I'd see this like bulge right here. I hated it.
Mm-hmm.
And so I think the idea is this. If you take it out and it has too much of an impact on the submalar space in your face, like under the cheekbone, then it's probably better anyway to leave it out and then go back and do some fat grafting or Sculptra or something in the submalar region. So you get that volume back, but it doesn't weigh down on your face. It doesn't move. So I think it's really hard to say like this is an irreversible procedure. If people are having this crisis that you had and they feel like they've made a mistake, a terrible mistake, the answer is just do something static in the submalar space. Put fat back there.
Yep.
Don't try to inject the buccal space with fat. Don't put an implant in the buckle fat pad to try and
space that would look so odd because you don't necessarily want it there. That's what I've realized.
It's like putting grapes in the side of your mouth.
No, I don't want it. I don't want it close to the jowl. I don't want volume here. I would want it up here or like underneath my, underneath
or
my cheek.
here, but not bulging out and not moving
No. So I'm glad that we talked about that because I really do think that that's still a trend on social media.
I think so too.
What is a trend? Buccal fat or the fear of buccal fat?
The fear of buccal fat.
You said it's because of injudicious providers, people who are unscrupulous about who they select and just want to cash in that easy money. I disagree. I think it's people who like lose a ton of weight and have like social media filters making them look gaunt.
Yeah.
Okay, now I have to ask. Have you ever had a patient come in and physically like show you a picture of themselves filtered and say like, this is what I want to look like?
No. Yeah.
Oh, yes. You're lucky because that happens to me all the time.
It happens all the time.
All the time. They're like, I want to look like this. And I'm like, your lips, I can't like, I always tell people I'm good, but I'm not Jesus Christ himself. So I can't make water into wine sometimes. Like I can really do a great job. And I can make you look natural and beautiful and definitely pop your natural like aesthetic features and make you look more balanced and like in other people's minds, like, just balance, like facial harmony, I can do. But when you're trying to show me a filter and say that's what you want to look like, that's just an unrealistic expectation. And how dare me to say, oh yeah, I can do that. Like,
but that's because you're not a Newport psycho. Because
I'm
you're not my
not.
Newport. You're honest.
I'm
You
honest,
set
and I just want my
realistic
patients to be happy and
You
realistic.
listen to their goals. You study their anatomy, and you make informed decisions. And you help them make informed decisions. That's the antithesis. That's the anti-hero to my Newport psycho.
Yeah.
And I think that's a beautiful way of putting it. I mean, yeah, I guess I have had people show me filtered pictures of themselves. It's hard. It's tough. It's a tough pill to swallow. I'm more of a listener. People usually tell me what they want, or they show me pictures of who they want to look like.
Yeah.
But yeah, I mean, I get a lot of Timothy Chalamet as far as mid face sculpting
so
and things like that. There's a lot of common names that I hear. I personally love Madison Beer's nose for the rhinoplasty.
She
consults.
is one of my woman crushes.
I
love her. The fact that we have the same name, like literally makes me.
Maddie is obsessed with Madison Beer.
I love you. Like I think
she's listening right now.
Oh, I hope so. Like I think she is so stunning. She's gorgeous. Speaking of like talent, like people. I tried to ask this earlier. Do you think? I mean, Lindsay Lohan got anything done?
I don't. I have a very controversial YouTube video on this exact topic, and I can get into it. I think she's done procedures and things like that, fillers and stuff like that. The biggest issue is lifestyle change. I think she's lost a little bit of weight. I think she's the beneficiary of all these social media filters, even in real time that you can use.
Yeah.
Her lifestyle has improved. I mean, she's probably off the wagon, and she's probably or on the wagon.
She's like on the wagon. She was off the wagon.
Yeah.
Now she got on the wagon.
She's on the health wagon. Like
she's on the wellness self-care hashtag, like
she's on the self-care train.
But like, look, I'm going to be mean for a second. I think she's absolutely gorgeous, but she's also lost a lot of weight. I mean, there's pictures of her arms and you can see that she's got laxity there. She's lost weight. And I think she had filler that was really too low in her face that was dissolved and placed in a better location. Better skincare, better lifestyle. It's not a facelift, folks. And people are pretty nasty on social media.
So mean. I think
people are being.
I have nothing to gain by looking an audience in the eye and saying she has not had a facelift. I have nothing to. I don't know her. I'm not her agent. I'm not her plastic surgeon.
We don't know what she got, but she looks freaking incredible. Whatever you're doing, Lindsay, keep it up because you look phenomenal.
And from a humility standpoint, as a plastic surgeon, I don't think plastic surgery can do that. I don't think plastic surgery can affect the change that we see in Lindsay Lohan.
Because she's 38?
It's more than that.
It's more than that. It's more than just one procedure. It's a total lifestyle change.
Oh, 100%.
And it's like what
Think
you
about
put
yourself.
in your body, what the things that she's doing on a daily basis. Like, it's not just one thing, Like I wish there was just like one thing you could do to fix everything, but it's not the case.
Usually. At what point do you tell someone that they've gone too far?
Yeah.
Wait, what? Metformin?
Yeah, metformin's pretty good. One thing to change everything.
I mean, it has
metformin.
It's a
diabetes drug.
I was gonna say, isn't that for like? I'm pretty sure my grandmother takes that.
Yes.
Yeah.
Like
but it's been around forever.
I've been taking it.
A lot of people.
You've been taking it?
I have, and I don't have diabetes, but I did
notice. Is it
notice.
for like weight loss? Like what are we talking about here?
Metformin does a lot of things. Everything from weight loss to blood sugar management. And I'm not an endocrinologist, and I'm not a family practice doctor. And I'm going to look at you and not tell you like, oh yes, I'm the best family practice doctor.
And this is not medical advice.
This is not medical advice. But yeah, I think metformin is a great medication. I think it really helps with sugar maintenance in terms of your liver's production of glucose and things like that. Also like surges, ups and peaks and valleys in terms of your own internal blood sugar content. It keeps things under control a little bit. And so a lot of people will theorize that that sugar in our diet is a huge problem in terms of aging, in terms of oxidation, in terms of all of these things, cancers. And I think blood sugar regulation is a wonderful thing. So metformin has taken a little bit of a turn in the last 5 to 10 years as not just a diabetes drug, but also a wellness and anti-aging medication for that reason.
Like on small doses?
I mean, I take a pretty large dose. I think it really depends on what your body tolerates. If you're getting really like low, you feel like
because we've known friends that haven't taken it.
Yeah,
they like pass out.
Then don't take it.
I know.
That's what I'm saying.
You gotta listen to your body. I do know. I've heard of this in the aesthetic industry. Obviously, I don't prescribe it. I don't use it. But I've heard like metformin. It not necessarily helps a lot with the weight loss, but it really has been helping people with like more like anti-aging.
Correct.
Like a lot of like celebrities.
And this is just thought. I've been on it for 3 or 4 years. I did Ozempic for like 6 weeks and I hated it. Oh, it looks terrible. I lost 30 pounds. People thought I was
in 6
sick.
Weeks?
Oh my God, yes. Because I eat a lot. I eat a lot. I have a stressful life.
You stress eat.
Big time.
I'm a stress eater.
Yeah, I could finish an operation and I can take down a piece of easy. A whole like large.
Could you imagine me and Zelken like
Oh my
stressed
God.
at the same time?
And I'm just like sitting in the corner, like pulling out my hair, not eating anything because I'm totally opposite. Like I was so stressed when I opened my business last year, and like I got so skinny, and everybody's like, "Are you on Ozempic?" I'm like, "No, this is literally Maddie's stress."
Now look at you.
I know. Now
You're thriving.
I'm thriving.
You're running the town.
I'm trying.
Wait. But I do have to ask: do you ever like tell patients? Like no is no. Like you've gone too far.
Yeah.
You're doing too
Absolutely.
much.
Like filler
Absolutely.
blindness, like surgery blindness.
Is that like a thing? Like, do you have to tell someone no? Because I feel like you have to.
You have to. And look,
There's people that walk near me, and sometimes I'm like, why didn't they say no? Why didn't they say no?
I have a hard time.
Okay.
Sometimes.
Okay.
And it's you think it's because you're financially motivated to take their money and do more.
Correct. I think that's a big thing in this area, though.
It's because if you're a good person and deep down in your heart, you know you're not helping them.
Right.
It's hard to say yes.
Amen.
It's hard to say
because there's a lot of people that just
to
want to take
somebody
your dough.
who's suffering and they really feel like, oh, I just need this one more hit. Just help me get through the next 2 months. Give me one more hit, doc. And it's like you're looking at them as like, I feel bad for you. I want to do something for you just to make you feel good for 2 more months. I don't want to leave you on these terms where you're like you're in this period of like dread.
Mm-hmm.
Right.
And so it's hard to say no. Okay. And it's not for the reasons you'd think. It's not for the money, because I'm not a Newport psycho. I do have like feelings. I have 2 little girls of my own. Like all my patients are someone's daughter.
Yeah.
Or someone's son.
Sure.
So true.
Oh,
someone's brother. You know what I mean? And it's hard. You said that. It's hard to like, yeah, sure. You didn't pay up. I'll do more, you know? Or it's tough. And if you say no, you also have this fear that they're going to go to somebody else who is not as nice as you, and they're going to say yes. And they're going to just, you want to kind of keep them within check. And the other hard thing is, as providers, especially as knowledgeable providers, we know that the best thing for these people sometimes is therapy, is a therapist who can help them explore why they're, fixating on something or desiring something. But the second we as aesthetics providers suggest seeing a therapist, we are insulting them. We're insulting these people. We're hurting them, even if our intentions are to help them. We are hurting their feelings, and we are undermining all of these concerns. And so it's really hard to find that balance. It would be super nice to like secretly refer them to a therapist, but you can't in practice do that without hurting somebody's feelings. It may be making them worse at the end.
Like they're body self-conscious, like it's something psychological that they need to.
It's real.
You probably see more body dysmorphia than we do. More, I mean, I guess we do see body dysmorphia, but it's more like facial with me. You know what I'm saying?
Like think about how many people we know in aesthetics that like say that to us like about their bodies, like constantly talking about it.
So sad.
I definitely have body dysmorphia myself. I feel like at times.
I feel like
we all do
because of social media. I hate to say it. I feel like a lot of people do, especially women. And it's like we get this unrealistic expectation. Now there's these apps that you can literally like slim your body
on live video. There's like people that are like doing it.
You can literally curve your body. So
why are you acting like this is so like cutting edge?
There
is something called Facetune.
Oh, I'm just saying.
And you can actually make your waist look smaller. It's AI. No, I know. Everybody knows this exists, and it's terrifying.
I know.
Okay, but the thing is, this is what I'm saying. People know it exists, but then they still say, oh my God, I want that body. Like, how can I get that body? And I'm saying like, that's not that's not her real body. That's what I'm saying. I'm like, people, yes, they know it exists, but they still look at those photos and are like, why can't that be me? I need to do that. Whatever she's doing, I want that. I even see social media and I see that. I'm like, holy crap, she's like a mate. Like, you know what I'm saying? And I'm like, is that realistic though? Like, is that actually
I see moms showing their kids Facetune and like letting them play with their filters and stuff like that, and watching kids on these iPads and iPhones changing their face, the little girls, little boys. I know. And it's the saddest thing.
It like literally breaks my heart.
It breaks my heart. You are right then and there breaking some kid's ability to interpret his or her own self-image. Right there in real time. You're watching a kid's ability to interpret how they appear to the world change. Everything's mobile now, and they can see with a small swipe of their finger an objectively better version of themselves.
Yeah.
And it's really, really sad. And honestly, sometimes I'm scared that I'm a plastic surgeon and I have 2 young girls. I'm scared that my wife, I've operated on my wife, and my daughters have seen that, and it's like normal to them. I'm scared that I'm raising them in Newport Beach, California, in a sense, because this is all normal to them. And then on top of that, you've got these filters that are going to make them look prettier, going to make their eyes look bigger, going to make their lower face look smaller, going to make their noses look smaller. And I don't want them to see that. I wish I was in rural Montana and my kids could just go to a little elementary school and be raised and eat apples off trees and eat venison.
That's literally what I want.
Yeah, but you know what? It doesn't matter anymore. With I hate to say it, but like
even in Montana, they're still gonna have access
they're gonna have a phone.
Yeah.
Yeah, it's true.
I know.
And my patients travel.
Yeah.
And your patients travel.
Yeah.
From these places to us. So there's no escaping it. You're right.
Yeah. So they're looking like a hot piece of venison I think in Montana.
You just gotta...
So who's our cycle then? The developers, the app developers? It's the entire industry. It's the entire construct.
You have to think about it though. They're after the adolescents.
Yeah.
They're easily targeted because they're innocent minds.
You just gotta hope that there's providers like us that will really like take time to talk with their patients and say no.
And be afraid and just and have that humility, that sense that A, what we offer isn't perfect.
Yeah.
That B, Lindsay Lohan's result is more than what we can offer. And C, that the reality is beauty doesn't make somebody happy. Achieving a certain goal, you'll never achieve your goal. You'll never get there because once you get one thing fixed, you'll want something else fixed.
It's so true.
So it's more like being psychologically sound in your own mind and your body.
Like we just want you to love yourself.
My best friend is a marriage family therapist, so she always I love her. But she does what she does and it's a hard job. But I feel like if everybody can just really focus on loving themselves, then outwardly, I feel like our society as a whole could be a lot better.
I like that.
I was literally going to ask you what you think we could do better, but I feel like she just answered that for you.
I know.
Well, wait, but I do have a fan.
That was so good.
Sorry.
Can we go back? Can we repeat that, please?
Wait, but I do have a...
That's his answer, actually.
We have a fan question for Dr. Zelken. We do. Do we have two or like one? Or,
no. Well, I took one of the fan questions about Lindsay because I'm a fan and I wanted to know.
That was one of the fan questions.
I mean, prove me wrong. Honestly,
no. Somebody prove me wrong. The fact is, we don't know what she did. Is at the end of the day, she just looks good.
I love that you said that she doesn't have one. I love that lifestyle can change. I love that
I'll
can happen.
up the ante. I'll say even if she had a facelift, that's not why she looks better. Okay.
Okay, great.
There's more to it than that. End of story.
Love it. Mic drop on that one.
Boom.
But we do have another one.
I'm not dropping this mic. Not on this table.
We do have another fan question. How many facelifts can one get in a lifetime?
17.
17?
Okay. So if I start now,
is that like legit? Are you joking?
I'm kind of joking, but it's so funny that there's this sort of mindset that I read online. I saw on Reddit that you can only get 3. You know, like after 2, your face is gonna fall off.
People always say 2. They're like, "Well, I can only get 2 in a lifetime." And I'm like, if you have skin, can't you remove it?
You can always tighten things. You know,
right?
The first facelift's definitely going to be the highest yield, and that's why a lot of times we're encouraging people to do it when they're starting to see the signs of aging.
Which one do you recommend? What age?
I think whenever you see
this is like honestly a personal question for myself.
Whenever the ages vary. I mean, there are people who have weaker facial skeletal features, for example, and so they don't really prematurely age per se, but their face is hanging at an earlier age in their 30s.
I've seen 25-year-olds
20s.
Same.
Okay,
like
and,
where
and
I'm
when
like,
you do this, it looks better. It's not because they're old, it's because they don't have your beautiful facial bone structure. Okay,
you do have great bones.
Not everybody has these cheekbones, this jawline, and when you don't have it, it causes the soft tissue envelope to descend faster.
What's the youngest age
that you've ever done?
28.
Okay. And then what's the oldest
28?
person you've ever done?
88. Facelift. The facelift procedure is not for aging faces only. It's also for beautification. And so if you love the way it looks when you do this and you're in your 30s or 40s, or if you're in your 30s and 40s and you have these annoying jowls or marionette lines and you see it in your mom and you don't want to look like that, then you can do something about it. And it sounds extreme. Facelift sounds extreme. But when you're putting thousands of dollars, tens of thousands of dollars of filler in your face and threads in your face over the years, it's probably riskier, let's be honest.
Well, that's a difference. Like, for instance, like, I hope I can talk freely, but like, I've done filler on Ashley. So I've done it on her cheeks and her chin, right?
Yeah.
A little bit.
Just a little bit.
We're all natural.
No, I basically am. I did 1 syringe in temple. Like, give me a break, people.
Just a little bit. But the thing is like, with her, for what she just wanted a little bit of a pop, like a little bit, right? it was perfect because I knew I can get you aesthetic results.
Well, she's talking about temple people.
Yeah, that you're going to look balanced and it's going to support you a little bit, right? But when I have a patient come in and they go, I want this, and I see so much laxity and everything, I always tell them, if you want this where you're pulling back, we need to talk to a plastic surgeon. And when they're like, I can't do surgery. I don't want to do surgery. I always tell them, like, I can make you look a lot better. I'm going to do, obviously it's not just one modality. It's not just filler. Like I focus on every different layer of the tissue, but I tell people I can make you look a lot better, but I cannot give you facelift-like results. I cannot give you literally what a surgeon could do to remove your skin and pull you back that tight. That's when I refer them to you. And that's the difference too, is like, we need to be realistic. Like if people are going like really far back, like and they have a lot of laxity, don't get me wrong, a little bit I can get, but like when they're loose and they're pulling it back like that, like that's when surgery talk needs to happen.
I saw on Instagram like advertisement or post or something about endo lift, and it was like,
okay, what is that?
I don't know, but basically it was like tape on this woman's face who already had great facial features, tape and like wires. And then you have this lady in the back pulling them really tight and saying endo lift. This is the all new minimally invasive strategy to improve your face. And I'm like looking at it and I feel so bad for everybody, educated and not, viewing this because you're like, oh, what is endo lift? This is the newest, greatest thing.
And I freaked out about temple filler. One syringe of temple filler. I could just imagine how bad it would freak out.
Oh, I know.
We're all human beings. We're all so susceptible to all of this stuff that's thrown at us. We don't know what to believe anymore.
It's true. Right. Even as like providers, I'm like, wait, what is this? You know what I'm saying? Like, have you heard of this? And I'm like, what? And you see this, like you said, the endolift or whatever on social media. And I'm like, what is this? Like,
this is why I will never be TikTok famous. I'll never be Insta famous. I'll never be YouTube famous, and I don't really care. I'm going to keep pushing and just doing my best and keeping my head down because I think it's really unfair to people to just overwhelm them saying everything is the greatest. You can educate. I'm an educator. I love my YouTube channel. I love to teach. But to say everything is the best thing in the world, period, hands down, is really confusing to a lot of people, and it takes advantage of people's weaknesses. And it's not fair. So I'm not an Instagrammer. I'm not a TikToker. I am a classic magazine shopping cart plastic surgeon. I'm happy to be that.
Board certified plastic surgeon.
You're a great one.
And,
really is.
And my swag. I'm looking at your hat. Why don't you wear something a little sexier? This is how I market. Okay.
Hats? Oh my God.
You haven't asked me about my beautiful hat. You kept calling it a dad hat today. But this is how I advertise. Okay. Get my name out in the community.
There we go.
Ask around. Haven't you heard of this guy? I'm happy to be the guy who is a little bit under the radar.
He's California.
Oh my God, I love this. Marketing, baby. It's marketing. Okay.
That's my jam.
So, well, I think you kind of said it, but if you could give me
this shit out.
If you could give me a one-liner, something to say about your psycho, what do you want your ending sentence to be on the Newport Psycho? Like what's one thing?
I want to copy and paste what Ashley said before.
Okay.
Like it's all about self-reflection. You've got to do your homework. Don't just take everything that's thrown at you with a grain of salt. You've got to question everything. Okay? Do your research. Really study the sources. And find somebody, a provider that you like. Find somebody that when you meet with them, you like them personally. You study their results. You like their results. Don't just go to somebody because you heard online how great it is. Don't shy away from buccal fat pad removal because you heard it makes you look gaunt. Really study it. And it takes a lot of work to do that. It's not easy. I'm not saying it is. I'm saying everybody needs to take accountability, including industry reps, to us plastic surgeons about what they're selling. Plastic surgeons need to take accountability. Plastic surgeons and nurse injectors and nurse practitioners, we all need to take accountability of everything that we do and be honest with ourselves.
I love it.
So everybody's got to take a little bit more responsibility. That goes to industry, that goes to providers, that goes to patients. To avoid the Newport Psycho.
Humility.
Love it.
Integrity, humility.
Woof.
Judiciousness. Love.
Dr. Zelken.
Live.
We love you.
Dude,
okay, where can our listeners find you? On that note, that was like...
Yeah, your YouTube, your Instagram, even though you're not a TikToker.
My name, Jonathan Zelken, MD. Fortunately, there's not too many Jonathan Zelken, MDs out there. I think I'm the only one in the world in the history of mankind. But I'm in Newport Beach, Westcliff Drive. I'm going to be building my own OR and office soon on Irvine Avenue near the airport.
Whoop, whoop.
Easily accessible.
Oh man, love it.
But yeah, you can find me here. You can find me online. About 30 to 40% of our patients are from out of town, out of country even. And we work really hard to treat everybody like our own. You know, we're all transplants, right?
Yeah,
Newport is a place of fostering inclusivity.
We got to come together.
Newport. Thank you.
Welcome
We're
here. It's a
bringing
very
the
nice
humility
place.
Yeah.
to Newport.
Yes.
Yeah.